A lot of people do not know that they can still get jobs in the National Health Service even without their HCPC registration. I'm going to break down how you can do exactly this in this video. The first thing that I would highly recommend that you do is to stop applying for Band 5 jobs. So if you're an international physiotherapist, an occupational therapist, a speech and language therapist, or healthcare worker looking to find a job in the National Health Service, I would highly recommend that you do not apply for Band 5 positions. This is because you don't have the UK work experience and you also do not have the HCPC registration. This is why I see a lot of physiotherapists get rejected in the National Health Service. Instead, I would highly recommend that you are targeting the entry jobs like the Band 2, Band 3, or Band 4 roles. These roles are roles like physiotherapy assistant, occupational therapy assistant, clinical support worker, or even rehabilitation technician. And most people do not know this, so they actually get stuck. And this is why I'm sharing this video. They actually don't understand that these entry routes are available into the National Health Service. The other thing that I would really highly recommend that you do is to get your UK healthcare experience. Once you get into the Band 3 or Band 4 job roles, you start to build the UK healthcare experience, and this changes the game for you. You learn how the NHS actually works. You learn how to communicate with your patients and colleagues. You learn how to document, and also you learn how to work as part of a multidisciplinary team. Most importantly, once you get your UK healthcare experience, you become more marketable and it's easier for you to get jobs. Now, the other thing that you need to do is then to start applying for your HCPC registration. Hear that clearly. Once you get into the door, you get your UK experience, the next thing is start applying for your HCPC registration. This is because now you have the UK experience and this is an advantage for you. You already understand how the system works. So instead of waiting to get your HCPC before applying, I would highly recommend that you start applying for entry job roles and then work on getting your professional registration. I'll be honest with you, it might be difficult to get your first role, but once you get that first role, everything else will be so easy for you. So in summary, make sure you firstly apply for the entry Band 3 or Band 4 jobs, gain your UK work experience, and then work towards your HCPC professional registration. This is the strategy that I would highly recommend that you use. Finally, if you're really serious about getting jobs in the National Health Service, I've created a physiotherapy course which gives you step-by-step guide, essential training of what you need to know about the job role of a physiotherapist or physiotherapy assistant. If you click in the link below, you will be able to get a copy of that training for yourself. I hope this has been helpful and I hope to see you in my next videos. Best wishes and have a great day. Grace.